I'm Dr. K with modernmedicinewoman.com. Even in the most devastating of pandemics, life still goes on. Earlier this week, I was working with a 41-year-old patient who was recently married. She came in for acupuncture to help with fertility, and I could see that something was really bothering her. She was struggling with the decision of whether or not to conceive because of the COVID-19 pandemic. So, having a baby is a huge decision, one that will change the course of your life forever. So, my recommendation to her was follow your heart. When you ask the heart a question, it often provides a very simple solution: yes, no, right, left, go, don't go. By the smile on her face, I knew her answer. So, we did all the baby making acupuncture points possible, mixed with customized herbs to enhance fertility. Our guest today is a special colleague of mine, and she uses her whole heart to heal patients throughout Northampton, Massachusetts. Welcome, Dr. Amy Major, Doctor of Acupuncture and Chinese Medicine, birth doula, author, and the Vice Chair of the American Society of Acupuncturists.
Thank you for having me, Dr. K. It's a pleasure to be here.
Yes, Dr. Amy specializes in acupuncture and traditional Chinese herbal medicine to support fertility, pregnancy, and postpartum recovery. She is a highly skilled and experienced medical expert and also a seasoned mama with a family of 6 kids ranging in age from 27 to 16. And Amy, if I could, I would give you Mother of the Year for this fun fact. Amy has nursed for a total of 16 years.
Well, the thing is, Dr. K, is that we know that nursing is good for our children physically, emotionally, psychospiritually, and they loved it. So they nursed and they nursed.
When we're talking about mothering, especially during the pandemic, everybody has their own situation that they're in, especially when we're talking about new moms trying to conceive. So, for many women struggling with fertility that have invested so much in things like IVF, what do? I've had some patients that have continued treatments, but several have taken a break in the midst of COVID-19. IVF can be stressful enough, let alone during a pandemic. So, what do you suggest to your patients?
So thank you, Dr. K. That's an excellent question. And really, it depends what they're doing with their RE, their reproductive endocrinologist. Some reproductive endocrinologists are moving forward, and some are encouraging their patients to take a pause. So when they're taking a pause, I encourage patients to continue with their Chinese herbal medicine, to continue with their Qigong or other exercise, to make sure they're continuing with their folate, CoQ10, vitamin D, and fish oil or DHEA, whichever their reproductive endocrinologist prefers, and is nourishing and nurturing themselves with warming foods. And we know from the work of Candace Pert that every thought we have, every emotion we experience, has a direct, measurable biochemical reaction in our bodies. And we want to be aware of that and bring ourselves to places of joy, whether that's listening to Dr. K's podcast, whether that's meditating, whether that's watching things that make you laugh, but finding the things that nourish you and nurture you.
We know that a birth plan is really important. It helps to establish order during labor, which can be a really stressful time for many, especially new mamas. But 9 months ago, nobody was worried about a pandemic. So, as far as advice goes for the mamas with a full baby bump, Dr. Amy, who might be afraid to go to the hospital or afraid of delivering at home, how can you best manage your birth plan in such uncertain times? Do you have any recommendations?
So it's important to figure out in this time of the coronavirus, would I feel safer at home where I could have my partner and my doula and my midwife, or will I, knowing myself, be better off in the hospital with either my partner or my doula? It's not that there's a right answer, it's about knowing what's right for you.
Right now, there's a huge home birth boom because people are very concerned about giving birth in the hospital in the time of COVID 19. Because I don't know what's going on in Minnesota, but where I live, women are being told, birthing people are being told that they can have one person, not two. So it means either a partner or a mom or a doula, one of them. And that's been really hard for people. So people are doing virtual doula work by phone or by computer, and just trying to figure out how we can support women in labor who are giving birth in the hospital. And the home birth movement has exploded where I live. And the home birth midwives are just basically running from birth to birth because women would rather give birth at home where they're less likely to contract the coronavirus.
For moms that are having hospital births, when can they go home as far as the recommended time? I know for myself personally, I felt like I could go home within a couple hours, and I stayed the 24 hours. But during the pandemic, what are you seeing happening in hospitals?
So what I'm seeing happen is hospitals is it depends. If you have a parent who's been self-isolating and wants to be there for you and your partner, or you and your partner feel really capable, you've had experience with babies and you want to go home, as long as your lochia, your bleeding is not tremendous, as long as your blood pressure is fine, you're drinking, you're peeing and passing gas, there's no reason to stay in the hospital unless there's an issue for you or baby and you can ask to go home. It is vital that you have support at home when you're going home early and that you have a deep knowledge base or resource base to make sure you have what you need because the last thing you want to do is end up back in the hospital with some kind of emergency or fear at this time.
Right. That's a really important point. And for postpartum mamas, the rest period associated with recovery isn't all that different than the stay at home orders countries have put in place to reduce the spread of COVID-19. In most cultures, 21 days to 6 weeks are usually dedicated for postpartum recovery and considered to be a time of vulnerability and illness, kind of in places around the world. And I know in China and Taiwan, many women commonly refer to it as doing the month. And I thought this was really, really interesting. La Cuarenta refers to the quarantine or 40 días, 40 days of recovery that many Mexican women take after the birth of a child.
And it's very interesting because La Cuarenta and quarantine, the word, the reason they talk about 40 days, it actually relates to the Bible because are a lot of times when there were 40 days for this and 40 days for that and 40 years for this. And so it all comes from the Old Testament. And the point is, it's a time of rest, right? We know it takes 6 weeks to develop a habit. And we want mom and baby to develop a good rhythm of breastfeeding that is uninterrupted, that is supported, that is nourishing. And that's what this time is about, is helping your cervix close down. My teacher, Raven Lang, used to say that for every day you don't take in the first 30 days, it will add a month on to your postpartum recovery.
Dr. Amy, can you share some of the insights that you learned? Because Raven Long was a home birth midwife for 20 years and an acupuncturist for 10 that you worked with, correct?
Absolutely, Dr. K. And the sentinel thing I learned from her, and if you only take one thing from this podcast, I hope it is this. Mastitis is a breast infection, but you get it from doing too much. So we want to be resting anytime either your lochia, meaning the blood that you have postpartum, either increases, gets brighter, you have any kind of cramps, anytime your breasts start talking to you. They feel funny, they feel tingly. Your breasts are your barometer. This is a signal that you're doing too much and you need to rest. Feet up. Feet up in a recliner, feet up on an ottoman, feet up, you are the queen, right? Being warm, using mother roasting, whether it's with moxa, whether it's with a heating pad, whether it's with a hair dryer in the first few weeks postpartum is an ancient practice used by many cultures around the world, and it helps our cervix close down, helps us stay strong, and supports the kidney energy, which is what is been used to grow your precious, beautiful, brilliant baby and what supports your brain. You'll hear mamas talk about milk brain or nursing brain. And it's true that the same energy that supports our kidneys supports our brain and supports breastfeeding. And your body will choose to nurse your baby well over our brains anytime.
And I want to go back to the concept of mother roasting because I was familiar with the ancient practice of it, but never knew that it was actually called mother roasting, which is so appropriate. But the idea of keeping a woman warm immediately after birth and during the first few weeks postpartum is this idea. And I know in traditional East Asian medicine, we use a lot of moxibustion, which is a form of heat therapy to do this. And moxibustion is amazing, right? It helps not only emotionally, physically, but also spiritually with that healing. And I truly believe that moxibustion and acupuncture saved my life after the birth of my daughter. I woke up around 3 in the morning with contractions about 3 to 4 minutes apart and kind of wishing that they were Braxton Hicks because I was at 37 weeks. But I went to the hospital, it was dilated to 8 centimeters, and my plan was always to have a natural birth. And within 5 hours, she was born.
Mm.
Perfect, no complications. It was as an easy of a delivery as I could ever hope for. So after the delivery, though, the doctor on call tried to pull on the umbilical cord and force the delivery of the placenta, and it tore. And not once, but twice, my doctor used his entire hand to manually remove the placenta from the uterus. And Dr. Amy, I would rather have had triplets. My whole body arched, like when you see people that have been possessed. It was such an amazing experience to have had happen with so many different hormones kicking through my body, and my daughter's still on my chest when this was happening. And later, he told me he'd never seen anyone go through a manual placenta extraction without surgery or anesthesia. Um,
Well, and I would say that in some cases that could be considered borderline malpractice because as long as baby was okay, there was no reason to pull on your cord. As soon as you pull on the cord, you are more likely to separate the placenta in a way that's artificial and actually cause bleeding and cause problems. So we want to be patient and wait for the placenta to deliver. I'm grateful that you came out relatively unscathed because aside of your being able to be present with that, that could have been a really dangerous situation for you.
Well, and
And
I feel lucky that I have the medical experience because after several office visits, 2 ultrasounds, they were sure that my placenta was completely removed. About 2 weeks later, I had a fever and such severe cramping, I could barely stand up. So I knew that something wasn't right. And so I had had no pain after birth and never took any medicine, but now, their only recommendation was to take ibuprofen and rest. So I did what I know best. I gave myself an acupuncture treatment and used a lot of moxa on my lower abdomen. And within 30 minutes, I was releasing literally fist-sized clots of blood and went back to the hospital. And they removed several fragments of the placenta. And I'll never forget the conversation with my husband and the doctor. They were joking about how it smelled like entrails of a gutted deer. But then he completely stopped laughing and looked at me and told me that I was lucky to be alive.
the first doctor was lucky you did not sue him. This was retained placenta that was completely caused by not letting the body do what it needs to do. Whenever anyone has fever postpartum, the first thing you want to do is go get an ultrasound and check for retained placenta. I'm stunned that they let you go for so long because whenever there's any kind of odor, we know that's retained placenta, and that is an emergency situation. And I'm so grateful, Dr. K, that you had the skills and knowledge to take care of you.
When I was working with a tribal doctor in Alaska and sharing that story, she had said, "Oh, well, we use seal fat when that happens to remove the placenta." And so it's interesting that this practice has been in place for years. This isn't uncommon. It happens to a lot of women. When I was doing research for this episode, I didn't realize that a lot of celebrity moms like Kim Kardashian, Christy Turlington, um, you know, retained placenta isn't a topic that hits the news often, but it's pretty common in the US and around the world.
Well, 2% is something, and it's something to be aware of, and all practitioners working with birth need to pay attention. And I'm really grateful that you didn't have something called an accreta, in which the placenta grows into the uterine wall, and that is a surgical remedy. So I'm grateful that you trusted yourself, your body knew what to do, and you honored your innate wisdom as a healer and as a woman and as a mother to do what was right for your precious, beautiful, brilliant baby. So you and your baby are both alive.
And I think that's true for not just me, but for all women. It's really important to trust your instincts.
It's the hero journey, right? Many of us have read Joseph Campbell, The Hero with a Thousand Faces, and all of those ideas are around giving men the experience that women have giving birth. It is the hero's journey because it stretches us beyond what we believe we can do, and yet we do it, and we are designed to do this.
Absolutely. So, with or without complications, postpartum recovery during the pandemic can be really tough. Grandparents are at risk for COVID-19 and often aren't traveling. A lot of family members are staying at home, which makes cuddling those newborns really difficult. I have a 2-month-old nephew that I've never even gotten a chance to meet outside of pictures and video call. So, as far as recommendations for offering support for those new moms and families, what do you suggest?
So, this is an extraordinary time, Dr. Kate, and we have to be creative. I want to remind us that we learned from Dr. Thomas Verny, MD, that not only do babies remember birth in his book, The Secret Life of the Unborn Child, but they recognize our voices, our smells, and our gaze. Your precious nephew may not recognize your smell through FaceTime, but he does already recognize your voice because he heard it in utero. And eye to eye contact with baby and mom and baby gazing increases everybody's oxytocin levels, the love hormone, even through screens. So I want to remind everyone that you have met this mama before she gave birth, before physical distancing. This baby already knows your voice and will respond to you and your voice. It's familiar and there will be recognition.
So, we need to call up all those babies and play some peekaboo.
Absolutely.
And then any other expert tips you can share for those at home in postpartum recovery?
Heat, rest, feet up, care. And we'll talk about what that means, right? Setting success for nursing. So always bring baby to breast, never breast to baby.
That's really great feedback. I know that when I was nursing my daughter, I nursed for about 2 years. About 9 months in, I had what was called nursing mother syndrome. I never even knew it existed. And I know a lot of diagnosis, but basically my neck muscles were so tight from holding her and looking down that I wasn't in a relaxed position. And those muscles were basically cutting off my nerve and blood supply. I actually went into the ER with chest pain. It was so bad. And so I can't say enough about getting in a really comfortable nursing position. So, yeah, any other recommendations on positions would be great to share.
Sure. So you want to have pillows, right? So baby is at the height of your breast. So you don't end up the way that Dr. K did, right? You also want to have a stool to bring your lap up to take pressure off your low back. So you've got a stool or an ottoman or your feet are up in a recliner. You've got pillows. So baby is at the level of your breast. It's incredible. I remember looking at my kids one day. My husband came home from work and I was nursing 2 children and the house was a wreck. And he looked at me and he said, "What have you been doing all day?" And I said, "I made 2 people. How about you?"
I love it. So true. I also want to acknowledge those moms who've experienced miscarriages. The loss of a baby comes with such heartache, grief, and so many different emotions, feelings. Dr. Amy, I'd love to have you back and speak more about how we can support families through this devastating loss.
I would be privileged to do so. Thank you, Dr. K. Loss of a miscarriage, no matter how early or how far along, can be devastating. I had a loss with my first precious one at 10 weeks. It was intense and painful, and luckily I had support from my husband, from Raven Lang, and my mom. There is a fantastic resource called Empty Arms that I recommend for any person experiencing the loss of a child. Also, the blog Happy Mama, Sad Mama by Carol McMurrick, who experienced the loss of a daughter at term for unknown reasons. When it happens and when you're in the middle of this, it feels like there is no other side and no way through. So we need to show up and give physical, emotional, and psycho-spiritual support to any person who needs it at such a time.
Dr. Amy, thank you so much for sharing your expertise. Any other words of wisdom for our listeners?
Well, I always used to tell my babies, and my face is flushing as I say this, wherever you go, every day of your life, your mama loves you and lives in your heart. And I would make them repeat it back to me in case, God forbid, something ever happened to me. I wanted them to know that and feel that in every cell of their bodies.
That's beautiful. You have some lucky kids. I'd like to take a moment to send love, healing, and maternal love to all those experiencing difficulty related to motherhood, whether you're struggling to conceive, carry to full term, ready to pop, holding your new little love, homeschooling your quarantine teens, or missing your own mom today. You're not alone. This episode is dedicated to the mothers of the world and to
Sandra Major Sorachaya Baskapel, my mother who died last week.
a mother's hug lasts long after she lets go. Happy Mother's Day.
Happy Mother's Day. Thank you so much, Dr. K.
Help spread healing around the world. Share your favorite episodes and subscribe to the Modern Medicine Woman podcast on your favorite podcast app and on our YouTube channel. Make sure to leave your comments and questions. We love getting your feedback. Go to modernmedicinewoman.com for more information and to schedule a consult with Dr. K and other licensed medical experts. And also follow us, stay connected on social media on Facebook and Instagram at Modern Medicine Woman Dr. K.